Tonight on KQED Newsroom, we speak with California Lieutenant Governor Eleni Kounalakis about the rise of women in politics and the state's response to the coronavirus pandemic. And we dig into the latest on the COVID vaccine hunt, when one might be available in California and who would be first in line. Plus, in this week's Look at Something Beautiful, we take in the first major retrospective in more than 3 decades of a pioneering Bay Area artist. Welcome to KQED Newsroom. I'm Priya David Clemens. President Trump continues his refusal to concede the election and has the backing of prominent Republicans and members of his cabinet. On Tuesday, Secretary of State Mike Pompeo said, quote, "There will be a smooth transition to a second Trump administration." Senate Majority Leader Mitch McConnell has refused to recognize President-elect Biden and instead supported President Trump's pursuit of lawsuits to challenge election results. President-elect Biden has called President Trump's behavior an embarrassment and is moving forward with his transition plans. A major shift for California will be Senator Kamala Harris leaving her seat for the White House. Governor Newsom will appoint her replacement in January. Joining us now by Skype from San Francisco is Eleni Kounalakis, the Lieutenant Governor of California. Lieutenant Governor, thank you so much for joining us this evening.
Hello, Priya. Great to be with you.
Let's start with the burning question. Your name has been mentioned as a candidate to fill Kamala Harris's Senate seat when she goes to Washington, D.C. Have you had any conversation with Governor Newsom about that position?
Well, Priya, I know he has a big choice ahead of him. I'm so honored that my name is among those who he's considering, but he's just going to have to sort through and figure out what he thinks is the closest to what the people of California will want to see, because whoever is appointed by the governor is going to have to run in less than 2 years.
And what do you think that is that the people of California want to see in this position?
For our state, people want diversity. I think there are a lot of women's groups who want to see a woman. But again, this is the governor's job is to fill that Senate seat. So I know he's got quite a few choices, and we'll see how he approaches it.
Well, let's talk about your work day to day right now. As Lieutenant Governor, can you tell me what's on the top of your agenda to accomplish?
Well, thank you for asking, because not everyone knows what the lieutenant governor does. But my job is, first and foremost, to be available in case the governor goes out of state or for whatever reason he's not able to do his job. But that leaves a lot of time for other things. So I work in and around public higher education. I sit on the UC, the CSU, and the community college boards. And then I also work in environmental preservation as the chair of the State Lands Commission every other year. And then finally, after I was elected, the governor, by executive order, designated me as California's representative for international affairs and trade. So I spent a lot of time working on the issue of climate change, trade, and other issues where California's voice on the world stage is really needed and very important, particularly over the last couple of years.
Well, the biggest issue facing the state right now is still the coronavirus, and we're seeing the state's numbers rise. Many counties are moving into more restrictive tiers. Are you involved in the coronavirus relief effort?
Priya, everyone has been involved in this, from the early stages of acquisition of PPE to the economic outfall that we're dealing with. It really has been an all-hands-on-deck effort, as well as, frankly, just making sure that we're out there talking to the public about how incredibly contagious this is, how deadly it is, and how important it is that, first and foremost, it's all of us as Californians coming together to do our part that ultimately will limit the spread, minimize the impact to the economy, and allow us to come roaring back after a vaccine is readily available.
Well, let's talk about that economic recovery. You're a member of California's Task Force on Business and Jobs Recovery, which has been in place since mid-April. Can you tell us what this group has accomplished? There has been some criticism that it hasn't gotten much done.
Oh, it's been an incredible group of people. Priya, I don't think I've ever seen in my life a collection of volunteers of the stature of these folks, from CEO Tim Cook of Apple to Janet Yellen is on it, the CEO of Chipotle. All kinds of people have come together from the private sector, from the public sector, labor, to help the state navigate our way through. Early on, it was a matter of, okay, if we reopen restaurants for takeout or curbside dining, how do we do it? What does that look like? To raising, frankly, a lot of money for a private effort, public-private effort to raise awareness for how people can protect themselves. To frankly, another big part of the task force has been helping to close the digital divide. We have students across our state who are really struggling if they don't have laptops, don't have iPads, or don't have connectivity. So there's been a lot of great work done by this group. And I know the governor and myself as a member of this task force were very, very grateful to the outpouring of support.
And I'd like to have you speak directly to small business owners, to restaurant owners whose livelihoods have really yo-yoed during this pandemic. When there are questions of whether they'll be able to reopen, if they can stay in business, what do you say to people who are struggling so much right now economically?
We are doing the best that we can. This is a very difficult thing. When you have a virus that spreads this easily, and you have people who sometimes forget how easily it spread. It's a very difficult situation. We are trying to be as consistent as we can, but the more we drive down the infection rate, the less likely that anyone sitting in that restaurant has the virus, the less likely, obviously, anybody is going to catch it. The other thing that we are doing every day is advocating as loudly as possible with the federal government to get more financial aid, more stimulus aid to help with those PPP loans, to help so that if you're laying off staff, that they can get supplemental help with their unemployment insurance. For people who get that supplemental, they're able to go get takeout from your restaurant. A lot of what we're looking for right now is that federal relief, and we need everybody who's affected to be out there helping us urge the federal government to do more.
Okay, I want to turn now to international relations. You served as the ambassador to Hungary from 2010 to 2013. You were appointed by President Obama, and you spent that time really learning a lot about Eastern Europe and about the world. Not long after you were sworn into office as lieutenant governor, you gave a speech in which you noted that your time as an ambassador gave you a window into many things. You said, "I saw how others see us, and what people see of America is still that great shining city on a hill. Yes, we have our moments. Yes, we have our challenges, but we are still the last greatest hope on earth." That was in January 2019. Do you see America's place in the world as having changed since then?
Yes, of course. I think that we're entering now, thankfully, as far as I'm concerned, a post-Trump world. And America is going to have to reestablish our leadership in the world. Joe Biden is extremely experienced in foreign affairs. He has a team around him that is very experienced, but the challenge is real. Going and reassuring our partners, our allies, that we are reliable. This is going to be a difficult thing. We also are going to have to engage with China, and the relationship between Trump and the Chinese is very hostile. He has saber rattled. He has put tariffs in place, but he hasn't accomplished anything in terms of being able to reconcile any of our differences. If anything, it's only spurred China on to be more aggressive in the region. Similar situation with Turkey, with Russia. So we have a lot of work ahead of us. But do I believe that America is still that shining city? Yes, of course I do. And we are. But it takes work and it takes commitment to our ideals, one of which, the most important of which, is our own national security. The thing that makes us secure, Priya, is a stable and secure world. That's where American leadership comes into play. And I have no doubt that Joe Biden will be very good at restoring it.
I think, that goes directly into my next question, which is, while you were in your diplomatic post in Hungary, you witnessed the rise of an autocratic government there under the presidency of Viktor Orban. Are there similarities between what you saw happening there and what you see happening in America today?
The internet, the digital revolution, the way that we communicate has created an opportunity for untruths to spread, for conspiracy theories to spread, for misinformation and propaganda to spread. And so for leaders, it's incumbent upon us to really be as transparent and clear, for the media to be as clear and fact-based as possible. I'm very concerned right here in California. We have elected officials like Congressman McCarthy, a Republican congressman from the Valley, who's very influential, as well as even Shannon Grove, who's the leader of the Senate Republicans in Sacramento. And they are still perpetuating these lies that somehow Donald Trump is still going to win. We have got to hold people accountable for lying to the general public. That requires the general public to insist that we demand truth and fact-based leadership from our elected officials.
All right, I want to touch just in the last few minutes before we go on your relationship with Senator Harris. You've known her for many years. She endorsed you early in your bid for lieutenant governor. You lobbied on her behalf to the Biden campaign. Tell us about the evolution of your relationship with her.
Priya, Senator Harris, or Vice President-elect Harris, is so deeply committed to public service that along the way she's worked with so many people and developed relationships where she has looked at people around her and made decisions of who to invest in terms of their leadership. In my case, I'd never run for office before, and she endorsed me a year before the primary, and I broke a glass ceiling with her help, becoming the first woman elected lieutenant governor. But it's always about the people who we represent and supporting others who she believes will do the best possible job as public servants. So to see her in Washington right now, the first woman vice president of the United States, a woman of color, a daughter of immigrants, this is the California story. So I am so proud of her and really looking forward to her leadership in Washington as vice president.
As you said, you both broke some glass ceilings. Do you think that gender matters when it comes to issues of governance? Do you think that you've changed the role of lieutenant governor in any meaningful way due to your experience and perspective as a woman?
I think it's now been scientifically established that when you have women at the table, when you have people of color represented, different voices represented at the table, when you have leadership that looks like the people who are being represented, you just get better outcomes. You need those voices. You need that diversity of experience. So I think it makes an enormous difference, and we've made some really great steps forward. Of course, there's still work to be done.
Lieutenant Governor of California, Eleni Kounalakis, thank you so much for your time.
Thank you, Priya. It's just really terrific to be with you.
The winter surge in coronavirus cases predicted by medical experts is here. The U.S. hit a new all-time daily high of hospitalizations and new cases this week, with more than 160,000 people testing positive in one day. In California, 11 counties are regressing to more restrictive measures, and the state has now surpassed 1 million cases since the pandemic began. On Monday, drug maker Pfizer announced its COVID-19 vaccine has proven more than 90% effective in preventing infection among trial volunteers. But more testing needs to be done, and it's unclear who would get the first doses and when they'd be available to the public. Joining us now by Skype from San Francisco is Dr. Peter Chin Hong, a professor of medicine and an infectious disease specialist at the University of California, San Francisco. Dr. Chin Hong, thank you so much for joining us.
Thanks for having me on, Priya.
So many health experts have said this pandemic won't truly be over until there's a vaccine in place. And we had some good news on that front this week with word from Pfizer of a successful drug trial. Could you, or maybe your coronavirus buddy there over your shoulder, tell us a little bit about how this vaccine is going to work?
Yeah, definitely, Priya. So this is my COVID buddy, and I use it for inspiration. And you see that there are all these spike proteins on the surface of coronavirus. So what the vaccine does is pretty clever, not being a live virus, because that will be dangerous to immunocompromised individuals, for example. It just takes the message for the spike protein, it delivers it into the cell. The cells become a factory of your body for making these spike proteins. So then the antibodies see these proteins, not on a virus, but just the fragments of the proteins, develop antibodies to them. And then when the real deal COVID comes along, your antibodies or fighting soldiers are there to capture it. So that's basically how clever the vaccine is, to make you induce antibodies to fight off real deal virus.
And in the trials, it's been very efficacious.
Yes, it's been very efficacious. I think we were all really surprised how efficacious it was. It showed that there was above 90% efficacy in preventing COVID-19 disease in individuals who got the vaccine compared to those who got placebo.
And is that a big deal, 90%? It sounds very good from a layperson's perspective.
Totally. Our bar was not that high for COVID-19 vaccines because of the public health and global pandemic urgency. So the FDA bar for a vaccine to come to market was about 50%. So 90% and above, it's like you not only passed the test, you got an A+. And to put in perspective, the influenza vaccine is only between 40 and 60% efficacious, depending on what year you're looking at, because it changes from year to year.
All right. Well, what are the next steps to bringing this one or another front-runner vaccine, like the one that's being made by Moderna, to market?
So the next step is really simply presenting the data, probably in a slightly more mature and more fleshed out way to the FDA. And the FDA will then meet and decide whether or not it would grant emergency use authorization, similarly to what they did with remdesivir and other entities before it gets full clearance. The full clearance from the FDA takes a long time. The emergency use authorization is a fast way to get it into the arms of individuals.
Let's talk about how this vaccine is going to be distributed. Who's going to be receiving this vaccine first? And in your opinion, are those the right groups to be targeting?
Yes, so these are all great questions. So the National Academy of Sciences did have a recommendation in 4 tiers. And the first tier, I think most people will get, which is healthcare workers, also individuals who are on the front lines of first responders, in other words, so firemen, ambulance drivers, etc. And, I think the million-dollar question, or the elephant in the room, is exactly how will minority populations or vulnerable populations play in this, because it cross-cuts many of these tiers. To give you some example, the next tier, which is tier 1A, includes essential workers, not included in the first tier, as well as individuals with comorbidities and those who live in congregate settings, like nursing homes, etc. So the issue of, of these populations, how do you prioritize, populations that bear the brunt of the disease from minority populations remains to be the question, and a lot of people are advocating one way or the other.
So, Peter, this week we saw a record increase in the number of new cases, both in the nation and in the state. So, as a doctor who treats coronavirus patients, what are you seeing in the hospital now?
So right now, Priya, I think we're seeing the calm before the storm. Hospitalizations don't usually pick up until about 2 weeks after we see a rise in the community, because it takes some time for individuals after they get diagnosed to actually get sick, and sick enough to either be hospitalized or go to the intensive care unit. So far, it's kind of looking like we were about a month ago, but again, the writing is on the wall, and there's only a matter of time before we see hospitalizations tick up. And I've been seeing that in other parts of the country, hearing it from my colleagues. And just yesterday, for example, we had a staff meeting in infectious diseases, and we are already talking about extra staffing to mitigate this inevitable rise that we're going to see in hospitalizations.
So do you think we should prepare for a strain on California's hospitals such that we would run out of equipment or space to treat those who have become sick with the virus?
I think our political leaders here have always aligned with science and public health, and everyone's worked together to be very proactive. And they've done that before in the other two surges, so that I'm putting have a lot of confidence in them. But with that said, even though we may have enough physical beds, I'm worried about healthcare providers going home sick. That's going to be probably at a higher probability during the winter. I'm still worried about enough supplies in terms of some drugs, personal protective equipment, testing reagent supplies. All of these things that I'm worried about, I wouldn't normally have to worry about if we had a national strategy and a national distribution plan, which we don't in these key areas.
What have we learned since the pandemic first began? How are treatments and responses changed? Because we've learned more than we knew in the spring.
Yeah, so I think we're really good now if we have enough beds and we don't have a surge in terms of preventing deaths. So I think we are able to, again, know which medications to initiate at various stages of the disease and where they would have the biggest bang for the buck. For example, in early phase, we typically would give an antiviral. In the later phases of the disease, we would give we'd focus more on anti-inflammatories to prevent inflammation. So we've learned a lot in that situation. I think, where we still have to do a lot of work on is, how do we prevent people from even getting to the hospital in the first place? So that's what, some of the studies with, oral pills that was recently published as a potential strategy, convalescent plasma or antibodies after people have been diagnosed to help prevent them from getting to the hospital. These are all, therapies of the future, but we're not there yet. And ultimately, I think we've learned a lot about ICU care, how best to treat people when they're critically ill, independent of all the medicines we're giving. But again, we're not going to be ready for a surge, even if we're, a super high surge overwhelming the hospital, even if we know exactly what medicines to use and in which sequence.
Well, California is recording the highest number of new coronavirus cases since the summer. Governor Newsom said it's because of private gatherings. Now, Newsom himself attended a 12-person dinner party, and he has since said he shouldn't have done that. But it's an indication of how hard it is to follow these stringent state guidelines, which say, no more than 3 different households should come together, gather outside if you're going to have a meal, make sure you wear masks at all other times, don't be outside, together for more than a couple of hours, use disposable utensils. Are these guidelines, A, necessary, and B, do you find them reasonable?
I think, unfortunately, they're necessary at this point because, again, I'm just looking at what's happening in the other parts of the country. And again, it feels like the calm before the storm. It's like when you get that weather report that the hurricane is coming, but the sun is shining and everyone's feeling fine. But then the hurricane comes. So I think we're in that area right now, that mindset. So what Governor Newsom exhibited was really the really tough situation, even with smart, responsible people, about that pandemic fatigue that we've all been experiencing since the beginning of the year. And
well, what do you say to that with Thanksgiving and the holidays approaching? What advice do you have about safely seeing friends and family? Is airline travel safe?
I think we've learned a lot about airline travel over the last few months, and the airline itself is going to be pretty decently safe. There haven't been major transmissions on airlines. You sit by the window, you can put the vent on you, you wear the mask at all times. And the air exchanges in airlines about 40 to 50 per hour, which compares about to 3 or 5 to a regular office building, and very comparable in the airline to what we have in the operating room. But the problem with airport travel and airline travel is the journey to the airport, hanging out in the airport, and the journey from the airport to the destination, because that's where a lot of noses and mouths come together, and that's where the virus is primed to transmit itself.
Right.
So again, if people can navigate that risky area, be safe on the airline, navigate going to the destination, all we can recommend is mitigating risk and not to think about risk as 0 or 1. But if something is important to go to, for example, you have a elderly relative who may not live to see another holiday, if you take all these precautions, you do the best that you can.
So, Peter, President-elect Biden has announced that there are 3 UCSF doctors who are being appointed to a 13-member panel that he's putting together to create a federal response to the coronavirus pandemic, which would be ready to roll out on day 1 of his administration. You know these doctors. Why do you think they were selected?
Well, I love what different strengths they bring to the panel. Dr. Gooseby is a gentleman and a scholar. He was chosen by Obama to roll out HIV meds to the rest of the world in the PEPFAR program. Dr. Kessler, David Kessler, was a former dean of the School of Medicine, was a former FDA commissioner, so understands the system really well and, laws and legislation around unrolling new medications and therapeutics. And finally, Robert Rodriguez, an active emergency medicine doctor whose whole career has been devoted to eliminating disparities and thinking about access of vulnerable populations.
Dr. Peter Chin Hong, thank you so much for your explanations and for your time. We appreciate it.
My pleasure, Priya. Thanks for having me on.
Stay safe. And now for a look at something beautiful. Artist David Park led the way in creating what became known as Bay Area figurative art. His groundbreaking work from the 1950s is currently featured in an exhibit at the San Francisco Museum of Modern Art. It's the first large-scale exhibit of his work in more than 30 years. You can find more of our news coverage at kqed.org/kqed-newsroom. I'm Priya David Clemens. You can reach me on Twitter, Facebook, and Instagram at Priya D. Clemens. From all of us here at KQED Newsroom, thanks for joining us. Good night.